So today, we're going to dive into a disease that has, believe it or not, haunted humanity for millennia, and yet it's still a massive threat in our modern world. We're talking about tuberculosis. But first, to get us started, I've got a question for you. If you were living a few hundred years ago, you wouldn't have called it tuberculosis. Nope. You'd know it by a different name, a name that perfectly and kind of terrifyingly described what it did to people. Any ideas? We'll get to that in just a second.
Okay, so let's get right down to it. Let's start with the absolute basics. What exactly is this disease that's been hanging around for so long? Well, when you boil it all down, tuberculosis, or TB as most people call it, is a chronic infectious disease. And the culprit behind all of it? It's a single type of bacterium called Mycobacterium tuberculosis. It's honestly wild to think that this one tiny organism can cause such a huge problem around the globe.
You know, when you hear TB, you probably think of the lungs, right? And yeah, that's its main target. But here's the thing, it doesn't always stop there. This infection can actually spread through the body and invade some incredibly important places. We're talking the brain, the spine, even your bones and kidneys. That ability to spread is what makes it so incredibly dangerous.
And that right there brings us back to that question I asked at the start. The old nickname for TB was consumption, and the reason is pretty grim. It got that name from how it looked. The severe weight loss, the weakness, it literally looked like the disease was consuming the person from the inside out. A truly terrifying idea.
And get this is not some new problem, not by a long shot. We know for a fact that TB is an ancient affliction. How? Well, archaeologists have found actual evidence of it in human skeletons that are thousands of years old. It's proof this bacterium has been with us for a huge chunk of human history.
Okay, so we know what it is and that it has a very long history. But the big question is, how did it manage to get from person to person so effectively for all these centuries? Well, the answer is all in how it spreads. The way it gets around is, well, it's actually pretty simple, and that's what makes it so incredibly effective. It's an airborne threat. Just like you see here, it's a simple chain. An infected person just has to cough, or talk, or sneeze. That act releases these tiny invisible droplets packed with the TB bacteria into the air. And then, all it takes is for someone nearby to breathe those droplets in. That's it.
And you know, this leads to a really, really important point. The environment you're in matters a whole lot. Because TB is airborne, things like overcrowded spaces and buildings with bad ventilation, they become the perfect breeding grounds for it to spread. This is exactly why things like poverty and not having access to healthcare are so deeply tied to this disease.
Now, this isn't just some interesting history lesson. This ancient disease is having a huge impact on our world right now, today. So let's shift gears and look at the modern scale of this problem.
And listen, that's not just my opinion. This is a direct quote from the World Health Organization. They officially call tuberculosis a global health emergency. That is some powerful, sobering language that really tells you how serious the situation is today.
And when they say global, the scale is just staggering. I mean, it's hard to even wrap your head around. We're not talking about thousands of people or even hundreds of thousands. We are talking about millions. Millions of people are affected by TB every single year. Now, this disease doesn't hit everywhere equally, not even close. As you can see here, there are definite hotspots. Regions like Pakistan, India, Bangladesh, and parts of Africa, they carry the heaviest burden. And just look at that column on the right. What's the contributing factor listed for every single one? Social and economic challenges. It ties directly back to what we were just talking about, poverty and access to care.
So when you step back and look at the big picture, we've gone from this ancient disease they called consumption, a disease that literally left its mark on skeletons, all the way to a modern crisis that affects millions and is officially a global health emergency. It's pretty clear the story of tuberculosis is far from over.
So it all really comes down to this one big question. How has this single bacterium managed to become one of humanity's most persistent and successful pathogens? To figure that out, we've got to get to know the survivor at the very heart of this story. All right, so let's start by meeting our antagonist. It's a tiny, microscopic organism, but it has a surprisingly complex strategy for staying alive. And here it is, Mycobacterium tuberculosis. This is the one and only cause of TB. People often call it Koch's bacillus, which is, a nod to the scientist who finally pinned it down and proved it was the culprit behind this devastating illness that people had known about for centuries.
And get this, that discovery was way back in 1882. So for over 140 years, we've known exactly what causes this disease. But as we all know, knowing your enemy and actually defeating them, totally different ballgame, especially when they're this well equipped. Okay, so the bacterium's defense system is just incredible. I mean, think of it like a biological suit of armor. You see that thick, waxy cell wall? That's not just some simple coating. It makes it incredibly tough to kill with disinfectants and even a lot of our best antibiotics. This armor also means it can survive outside of a person for a long, long time. And here's the really clever part. It grows super slowly. It's a brilliant stealth tactic that helps it hide from our immune system's first responders.
So with armor like that, you can see it's built to last. But its real genius, that lies in how it spreads. It's a truly silent invasion.
So the way it works is deceptively simple, and it's all airborne. This isn't about physical contact. It's literally about sharing the same air. When someone who has active TB coughs or sneezes or even just talks, they release these tiny, invisible droplets loaded with bacteria. Now, here's the really scary part. Those droplets can just hang in the air for hours, just waiting. And when someone else breathes them in, the bacteria have found a new home, settling deep down inside the lungs.
But, just getting inside your body, that's only the beginning. What happens next isn't always an all-out war. Actually, more often than not, it starts as this uneasy truce between the invader and your body's defenses. And this is maybe one of the most important things to get about TB. Okay, so your immune system doesn't just sit there. It fights back. It sees the threat, and it basically corrals the bacteria, walling them off inside these tiny little cellular prisons called granulomas. The bacteria are effectively trapped, contained. They're still alive in there, but they can't multiply and they can't cause any damage. This whole situation, this stalemate, that's what we call latent TB.
So this brings us to the two really different states of this infection. On one hand, you have latent TB. Think of the bacteria as sleeping. You have zero symptoms and you can't spread it to anyone else. This can go on for years, maybe even your whole life. But then you have active TB. Now the bacteria are awake. They're multiplying. They're causing symptoms like a bad cough and fever, and this is absolutely critical, you are now infectious to other people. The truce is officially over.
So, what breaks that truce? What allows these bacteria to stage a great escape from their little prisons and go from being a quiet, latent infection to a full-blown, life-threatening disease?
Well, the answer is pretty straightforward. A weakened defense. See, the bacterium is patient. It doesn't usually break out on its own. It just waits for an opening. Things like malnutrition, other infections like HIV, chronic conditions like diabetes, or even just long-term stress can weaken your immune system. All of these things are like accomplices that give Mycobacterium tuberculosis the exact chance it's been waiting for, to reactivate and take over.
And if you think that's clever, the bacterium's adaptability doesn't stop there. It's also an absolute master of adaptation. Over time, especially when people don't finish their full course of treatment, it has evolved into new strains that are resistant to our most powerful antibiotics. And that, of course, makes an already tough fight almost infinitely harder.
And all this really goes to show that the fight against TB isn't just a biological one. It's about this tiny organism exploiting weaknesses not just inside our bodies, but inside our societies too, which is what turns a bacterial infection into a social and environmental problem.
Because you see, TB absolutely thrives in certain conditions. Overcrowded living spaces, rooms with poor ventilation where those airborne droplets can just build up, and a lack of sunlight, which can actually help kill the bacteria. When you put all these factors together, which, let's be honest, are so often tied to poverty, you create the absolute perfect breeding ground for this thing to spread. It really shows that where we live can be just as important as how strong our immune system is.
So we're going to break down every single sign, from those first really subtle whispers to the most alarming shouts.
So long before it ever hits the lungs in a way that we'd recognize, tuberculosis often kicks off with these really vague, kind of systemic signals. You can think of it like your body's general alarm system just starting to blare, telling you that something just isn't right.
Okay, look at these. A low-grade fever that kind of spikes in the evening, drenching night sweats, dropping a few pounds without even trying, or just feeling completely wiped out all the time. I mean, notice how easy it would be to just brush these off, right? Oh, it's just the flu, or I'm just overworked. But here's the key with TB. These things don't go away. They persist.
And you know, all of those early signs, they kind of culminate in this one single feeling, malaise. It's a weird word, but it basically means you just feel off. It's not a sharp pain or some dramatic symptom, but it's this nagging, persistent feeling of being unwell that you just can't seem to shake. This is your body's real foundational warning.
All right, so let's move on to the one symptom that everybody knows, the cough. After those general alarms we just talked about, the disease often settles into the lungs. And this is when the signs get way more specific to a respiratory infection.
3+ weeks. This right here, this is the magic number. I mean, think about it. A cough from a cold or the flu, that usually clears up in a couple of weeks, right? But a cough that just hangs around for 3 weeks or more, that is a major, major red flag for tuberculosis. It's something you have to pay attention to. The duration, it's everything here.
And this cough isn't usually just a dry, hacking thing. It's often productive. Now that's just a clinical way of saying you're actually coughing up stuff, sputum or phlegm. This tells you there's a real infection and some serious inflammation going on deep inside your lungs.
And that brings us to one of the most frightening symptoms of all, hemoptysis, coughing up blood. I mean, even if it's just a little bit, like blood-streaked sputum, it's a huge sign that the infection has progressed and is actually damaging your lung tissue. This is a clear, unmistakable signal that there's a serious problem.
And to round out the whole picture of what's happening in the lungs, people with TB often get this sharp chest pain. It gets way worse when they take a deep breath or cough. Then, as the disease gets more advanced and damages more of the lungs, simple shortness of breath can set in, making even daily activities feel like a huge struggle.
Okay, now this is where the story gets even crazier, because TB doesn't always just stay put in the lungs. Nope. The bacterium that causes it, Mycobacterium tuberculosis, is incredibly tough. If your immune system can't box it in, it can actually escape into the bloodstream and set up shop almost anywhere in your body. This is what we call extrapulmonary TB, and its symptoms are, you guessed it, incredibly diverse.
Just look at the incredible reach this disease can have. It can pop up as swollen, firm lymph nodes in your neck, and they usually don't even hurt. It can attack your spine, causing pain and stiffness, a condition known as Pott's disease. If it gets to the lining of your brain, it can cause meningitis with these terrible headaches. It can even hit the kidneys, showing up as blood in your urine, or your abdomen, causing pain and swelling. It's just wild.
So as we've seen, TB is so much more than just a simple cough, right? It starts with these general warnings, then it moves to those classic respiratory signs, and then it can spread throughout the entire body. Really understanding this progression is the key to recognizing it.
Let's boil this all down to a simple framework. How to think about this. First, you've got to notice those general warnings, those subtle systemic alarms like the persistent fever, the night sweats, the fatigue. Second, you have to identify the respiratory signs, and the big one is that classic persistent cough that lasts over 3 weeks. And third, you have to be aware that it can spread. Always remember that some unexplained pain or symptoms somewhere else, from your neck to your spine to your kidneys, could potentially be linked.
This quote really just says it all, doesn't it? Tuberculosis is a disease of 1,000 faces. Knowing them is the first step to fighting it. It's so true. You just can't fight an enemy you don't recognize. By understanding this whole spectrum of symptoms, from that vague feeling of being unwell all the way to specific organ pain, we're just so much better equipped to catch it early.
Ultimately, awareness is our most powerful weapon against this disease. Recognizing this complex constellation of symptoms is that first absolutely essential step. So the real question is, once we see the signs, what do we do next? Now for the good news. We have a blueprint for victory. A really effective one that's used all over the world. It's called the DOT strategy, and it's our #1 plan of attack when we're dealing with an active TB infection.
The secret sauce is right there in the name, directly observed treatment. This isn't just about giving someone a bag of pills and saying, good luck. No way. This approach, which the World Health Organization totally backs, means a healthcare worker literally watches the patient swallow their medicine. Every single dose. Why? Because it's a total game changer for making sure people actually finish the long treatment, especially when they start feeling better and are tempted to stop. It's all about making sure it gets done right. The treatment itself is basically a 2-phase attack. Think of it like a 1-2 punch. For the first 2 months, you're in the intensive phase. This is an all-out assault just to knock down the number of bacteria as fast as possible. But you can't stop there. The next 4 months, sometimes longer, that's the continuation phase. It's absolutely essential for wiping out any of those tough, lingering bacteria and making sure the infection doesn't just come roaring back.
And here's the arsenal we use to get the job done. We never just use one drug. It's always a combination. These powerful antibiotics, you see them here, isoniazid, rifampicin, they work together to just overwhelm the TB bacteria. It's like attacking a fortress from all sides at once. It makes it way, way harder for the enemy to fight back.
But just like in any real battle, the enemy adapts, it fights back. And the single biggest threat we face, the enemy's main counterattack, is drug resistance. This is where the fight gets so much harder.
So what gives the bacteria the chance to get stronger and resist our drugs? It's this, right here. The number one cause, by far, is when people stop their treatment too early. You start to feel better after a few weeks, you think, hey, I'm cured, but you're not. Stopping the medicine lets the toughest, meanest bacteria survive, and then they're the ones that multiply.
And this just lays it all out, doesn't it? Look at the difference. On the left, that's the standard plan, 6 to 9 months, manageable drugs. But if you don't stick to that plan, you end up on the right. A much longer, much more brutal fight, using stronger, way more expensive drugs that, frankly, can have some really severe side effects. The choice is pretty stark.
When you don't finish the treatment, you're not just getting sick again, you're creating an evolved enemy, a superbug. We're talking about multi-drug-resistant TB, or MDR-TB, which can shrug off our best 2 drugs. And even worse is XDR-TB, extensively drug-resistant, which is resistant to even more of our options. Treating these is an absolute nightmare.
So yeah, treatment is our attack plan, but the best strategy of all? A good defense. So let's talk about our fortifications, all the things we can do to stop TB from ever getting a foothold to begin with.
Our first line of defense is all about you. It's personal, and it's these simple, everyday habits that can make a massive difference. Covering your mouth, making sure there's fresh air circulating, eating well. All of this stuff helps stop the bacteria from spreading and keeps your own body strong enough to fight things off.
We've also got some medical defenses in our toolkit. The BCG vaccine's a big one, especially when it comes to protecting the most vulnerable. Now, it's not a perfect shield against lung TB in adults, but it's incredibly good at preventing the really severe, life-threatening kinds of TB that can hit babies and little kids. And finally, this isn't a fight you can win alone. We need community fortifications. This is a team effort through and through. It means finding and treating people early to stop the chain of infection. It means tracking down people who might have been exposed. And it means educating everyone and, on a bigger scale, improving the living conditions that allow TB to thrive.